I work in a cancer center within a big healthcare system in New York City, and COVID-19 has kind of significantly impacted on the cancer care. I mean, it's impacting throughout the whole health system, but I think it's having serious effects on our abilities to deliver cancer care, because patients with cancer and the heme cancers are vulnerable to the infection, and so we have to kind of do a risk-benefit analysis a lot of the time about what are the risks of exposure to the virus by bringing them to the clinic versus the benefits people get with the cancer treatment they're being offered. And this is kind of serious. We have to take it very seriously. And it's meant that we've kind of significantly changed our approaches to treatment during the course of the pandemic. So autologous stem cell transplant for myeloma, say, was one of the kind of go-to options for treatment. But that's all but not happening where I work. And we've moved away from intravenous infusions where we can as well. So we've tried to take a risk management approach about this, which has led us to moving towards using more oral chemotherapy regimens and to combine this with a virtual medicine approach. So if we can keep people away from the hospital outpatients, we will. And so in myeloma, that's led us to avoid the use of stem cell transplantation, to favor oral proteasome inhibitors such as ixazomib, or to use self-administration by subcutaneous injection. And this is really leading us to use an IMiD plus a proteasome inhibitor as a combination that can be given orally. In addition to that, some of the more intravenous regimens, we've also kind of largely moving away from those, which I think is decreasing the efficacy of the treatment. But again, from a risk management perspective, I think it's good for the patients to prevent them being exposed to the virus. The other thing on the more inpatient kind of approach is if patients become unwell, we've kind of, as normal, tend to stop the anti-myeloma medications to allow people to recover and get through the virus as well as their body will allow them. And this is being a successful strategy